the community who choose not to receive the vaccine. You can start by making these vitamins available to the elderly in our community through the Agency on Aging, then to local care homes, nursing homes, assisted living facilities, and then through the community health center. After that, you can possibly make these vitamins available to the general public. Maybe have where the drive-through flu shot clinic is, you can set up a once-a-month vitamin pickup area at the fairgrounds, just like you do for the flu. Also, instead of getting a flu shot, the 50% of us who choose not to get one would get a bag of vitamins. This way, the health department is serving all of Flathead County, and not just those who elect to get a vaccine. This would be a win-win-win for all involved. Those who want vaccines can get them. Those who don't want a vaccine or want alternatives, they can get them too. And the health department fulfills their mission, which is to provide quality public health services to ensure conditions for a healthy community. Thank you very much.
Next up, we have Tara Lee.
Hi, my name is Tara Lee. As a frontline RN, I'm wanting to make sure that the new health officer supports science, public safety, and not the anti-mask rhetoric that continues to be peddled. I want to say that I'm thankful for Bill Berg's leadership and Kyle Waterman, Dr. Habor, and Roger Noble for listening to the experts and following the recommendations. As a healthcare worker, I feel like I'm getting stabbed in the back by half of my community and half of the health board. We should be 2 steps ahead at all times, and due to people putting roadblocks up left and right, the 4 women of the board and the 3 county commissioners is who I'm mostly referring to, and failing to stand up for protecting our community, which was an oath that they took by joining this board. The other day I was at work and I was asked, what size scrubs do I want to wear? I was asked this for preparation of our pediatric unit being turned into partially being turned into a pediatric COVID unit for the state of Montana. It is here and we are in the fire. We needed help 2 steps ago. Please, as a healthcare worker, I want to encourage the use of public health experts to be the driving force of what our community should do to keep us safe. Thank you.
Julie, can you unmute yourself?
Yes, I can. Thank you. I wanted to give public comment today. I submitted written comments back for the November 2nd meeting, and then I happened to be able to attend, but I hadn't asked to speak at that meeting. I was so saddened by that meeting that I actually wrote a letter to the editor that evening. And it never got published. I'm sure I could spin some conspiracy theory about being censored, but it probably has to do with the fact that the local newspaper was inundated with letters to the editor because it was the week of the election. And so I just wanted to speak today and share my frustration as a community member. You know, I thank you to the board for the work that you do. I also serve on a local school board. And so I know what a thankless job it is, certainly at times to do the work that you do. But you are here to protect the health of the valley, the entire valley. And this notion that, you know, people that are at risk can just hibernate until COVID is behind us just isn't realistic. My husband works full-time in assisted living. And this has been such a stressful, horrendous time. We saw the outbreak hit the Brendan house last week, and the stress that people are living under that are in that environment. You know, he has to come home. I work full time. We need to be able to continue to send our children to school so that we can work our full-time jobs and support our family. And so it's not possible that everyone that's at risk can just hibernate and the rest of us can go on with our lives. And so while we have new orders from the governor, and I'm thankful for that this week, those, my guess, will be ending in January. And so I just implore you, please, as board members, to take the steps that are necessary to protect our community. Since the meeting a couple weeks ago, I personally have had my third grader need to be quarantined because a classmate tested positive. And I can't tell you how great the Flathead County Health Department has been with communication, the systems that they're using to monitor if any of those close contacts are developing symptoms has been great. I also really sadly yesterday morning started my day with an email that one of my students' fathers died from COVID, and asking for leniency and an extension for the student. It's
Hey, Julie.
serious, it needs to be taken seriously, and I hope that you will protect us. Am I out of time, Carrie? Okay.
Okay, let's move to Sharon Stratton.
Hi, I'm Sharon Stratton, and I'm a former county commissioner and a member of the Board of Health. And I would implore you to not wait until you lose someone to COVID before you realize the seriousness of this situation, and to enact some proper guidelines and enforce them. Because without that, this valley is going down the tubes, and I'm afraid that a lot of us are going to go down the tubes with it. Thank you very much.
All right, next we have Lynn Stanley.
Hi, I'm like others very concerned about what's happening in Flathead. It's possible to get on top of this spike, and it takes local leadership is the first ingredient in that, and that's why I would ask the board and the health officer to take the lead and to be supported by our commissioners in the preventive things we can do, like masks and social distancing, and also to lead the understanding that a vaccine is going to take a while, particularly to get out to most people. And we will need the masks and social distancing for the interim. And if people like me, I'm older and I am self-isolating. If I could have confidence that when I come out, everybody would be wearing a mask, I would go out more. And I can tell you that there's a price to pay for being isolated for so long. But thank goodness for Zoom, where I can see your smiling faces. But if everybody were convinced of the need for masks and distancing, it wouldn't be as necessary for so many of us to have to be isolated. So please take care, and the main thing is being committed to fact-based decision making, and I guess that underlies what you and the commissioners would do if you go forward. That's my main message. Thank you. And thank you for the hard job that you, Carrie, and the board are doing. It isn't easy, I know.
Georgia, you're up next.
Thank you. I'm a 61-year-old resident of Kalispell, and at a high risk. I have only 65% lung function. So basically, I've been at home in my house or in my yard since this started. I am fortunately able to have my daughter and her family within my bubble, or I would probably be crazy without seeing my grandchildren. I have a few thank yous that I want to say. Thank you to all the dedicated staff at the health department and your hard work during this COVID crisis. Your long hours of service and dedication to the community have not gone unnoticed. Thank you also to the staff at Kalispell Regional Medical Center. That's all of the staff, from the doctors to the nurses to the technicians, all the way down to the people in housekeeping and maintenance. Their lives have been greatly impacted. Thank you for risking your lives every day for caring for our COVID patients and all of their regular patients they see on a daily basis. My last thank you is to Governor Bullock for implementing his latest mandates for the state of Montana. I appreciate that he had the courage to stand up and protect our citizens when the Flathead County Commissioners and half of this board have refused to do so. That's the end of my comment. Thank you.
Elizabeth Patterson, sorry. Elizabeth, you're next. All right, moving on to William Douglas. If you'd like to unmute yourself. All right, Carissa Dennery. And next we're going to Sarah, who I can see on the call. Sarah, can you unmute yourself if you wish to give comment?
Thank you.
I just unmuted.
Is it unmuted?
Yes.
Okay, thank you. I want to thank the public health officers at the health department, and I just want to let you know how appreciated you are by my family who take all of your recommendations seriously. Thank you so much for your work. I'm sorry I was not able to be there yesterday to thank you in person, but I can't imagine the work that you are under. I'm also curious if these comments are going to be made available to the health officer who is going to be offered the position. That's a question for you.
And Sarah, typically there isn't a response to public comment.
Oh, sorry. Okay. All right. Oh. Okay. I have 2 students in Kalispell Public Schools, and we must keep our schools safe and open. It is the very best place for them to learn and grow. And as statistics show, the very safest because mask wearing and gathering sizes are enforced. We can only keep this going if the new community health officer is immediately prepared to set and enforce smaller gathering sizes, mask, and social distancing in our at-large community. It is imperative they come ready to provide leadership, clarity, and tenacity in dealing with this pandemic. Keep our kids in school, our economy moving, our community safe. We can see some light thanks to emerging vaccines. We need them to guide us there with an unwavering commitment to science and responsible community health. I don't think that either one of those things are too much to ask for an incoming health officer. Thank you, and I look forward to hearing your decision.
Marie Mitchell, you're next.
Now more than ever, we need community leadership to act courageously in defense of public health. as we are at a 2% infection rate in our county. The health and safety of our most vulnerable friends and neighbors depend on our ability to depoliticize and destigmatize the harsh scientific reality inflicted by COVID-19 on our bodies and our markets. It breaks my heart that so many well-meaning but misguided community members have been misled, and to be honest, I do not know how to fix this. What I do know is that Flathead County and Kalispell in particular is grossly out of alignment with the guidelines set by the White House Coronavirus Task Force, the CDC, and the World Health Organization. While that misalignment may have protected some of your positions within your organizations and your communities, it's betrayed those you are here to serve. Now that we are through the election, I pray each of you will dig deep and challenge the assumptions that have allowed you to avoid the leadership task at hand. If you are still unclear on the accuracy of the data and the wisdom of the scientifically backed recommendations, then I implore you to connect with the community organizations doing the work of treating the ill, to earnestly seek clarity. If these routes do not sway you, then consider volunteering in the COVID-19 unit, connecting with a local long hauler, or confronting the contact tracing tied to a local COVID-19 death, which could have been prevented with leadership willing to enact, support, and enforce guideline adherence. We need to stop passing the buck. We need your leadership now. We need you to lead us through this pandemic with as many of our lives still intact as you possibly can. Please.
Next up, we have Lindsay DeWard.
I just want to say thank you for standing up for our rights and being there for us and hearing us out. We look forward to pushing through this. The virus isn't going anywhere. We just have to continue to live our lives, and we look forward to doing that with you guys. And thank you for not putting any further restrictions on us.
Next up, we have Sherilyn.
Hi, thanks to all of you. In fact, my comments today are all about thank you. So thank you to the selection committee for finding a health officer during a pandemic. I'm sure that was not an easy thing to do. I want to thank the Board of Health members who have been trying to protect public health and public safety, not only during a pandemic, but doing it while Dr. Annie Bukacek has been deliberately undermining the hard work of local physicians, the health department staff, and school officials. Thank you to Tamalee St. James Robinson for volunteering and stepping in during such a difficult time, and to Tamalee, health department staff, Bill Berg, and Dr. Hybor for repeatedly explaining data when Dr. Bukacek and others tried to confuse the public with misinformation and turn COVID-19 into a political situation at a time when we all needed to pull together. We know what works: masks, social distancing, and smaller gatherings. I am grateful to the Board of Health members who are working hard to promote this information so that we can keep schools and businesses open. Thank you for consistently putting the community first.
Next up is Trish Pandina. Moving on to Lance Isaac.
Hi, my name's Lance Isaac. I've had the privilege to serve on Kalispell Public School Board for the last 6 years, and I'm the current board chair. I want to thank Tamalee Robinson and the health department for their prioritizing the contact tracing to keep our schools open. On the 10th of November, our school board came together, and we wanted to unanimously create a letter to share with the public. And what we said was Kalispell Public Schools made the difficult decision to deliver classes in person 5 days a week, based upon recommendations from local and state medical infectious disease experts, as well as the CDC, on how to prevent the spread of COVID-19 virus. Before making our decision, we heard from a significant number of parents, teachers, and staff asking that we implement these same recommendations. The simple recommendations of wearing a mask, washing your hands, and watching your distance have been clearly effective in limiting the spread in the schools. Contact tracing has indicated that KPS COVID cases have been caused due to spread outside the school buildings. And while the Flathead community has seen a large increase in cases, KPS has not. And you are welcome to go on the school district's website and really see those active cases have not coincided with what we've seen in the county. As we approach Thanksgiving, the holiday season, the Board of Trustees are concerned about a resurgence of COVID cases in our community as families and friends come together. The board, our teachers, staff, and especially our students work hard to keep our schools open and everyone safe. We ask everyone to do their part to slow the spread of this dangerous virus by using the same protective measures our students do at school and staying home if you're sick. Thank you.
Next is Carol Sugarman. After that, we have Erica.
Excuse me. Hi, my name is Erica Langasher. I've spoken before and I'll speak again. I'm a critical care nurse who works with the sickest patients at CareMC. I work both in the COVID unit as well as in the ICU. I'm also trained as a public health scientist, and I recently took a job with the CDC Foundation to support efforts for COVID-19 prevention because it felt like I wasn't doing quite enough at the bedside. So I'm working across Western Montana, particularly in assisted living and long-term care facilities. But as a nurse, I have been and will continue to be the person at the bedside who's comforting a patient, talking them through what's about to happen to them right before they get intubated. And I wish I could paint that picture because it's a horrifying and terrifying moment for those patients. I'm also the person who has to call their family, their loved ones, their sons, their daughters, their wife, their husband, and say, you might not ever hear their voice again. It's not fun work, and it's real, and it's happening on a really regular basis in our hospital. And I also want to be clear that we don't just care for people in the Flathead Valley. We care for this entire region. We're a regional hospital, so the numbers in our valley are really important, but we also need to take into consideration what's happening in the surrounding communities as well. I'm also more recently taking care of a lot of patients in the ICU who've been cleared of the virus, but who no longer have the capacity to breathe on their own or don't have the neurological function, so they remain on ventilators. The division in our community is heartbreaking, and it seems to suggest that our response to COVID is all or nothing. I believe there's a great deal of room for effective mitigation in the area that lies between a lockdown and outright denial. And these are exactly the measures that our health department, our health officer, our regional hospital leadership, and the governor are asking of us. They're thoughtful, they're reasonable, and they're evidence-based. As health board members, your charge is to protect the public health by supporting the efforts of the department that you oversee. And I've been really confused by this in the last several months. Communicable disease is only one thing in your long list of things to shepherd, but it's certainly the thing that's taking up the most airtime, and I think rightfully so. And while some of you may not personally agree with the measures of distancing, masking, and minimizing public gatherings, these are exactly the measures that evidence tells us work, and it's telling us this again and again, and with greater amplitude. To that end, I urge you to collectively and vocally support these measures together. And in so doing, the many educators, frontline workers, public servants who show up for our community day in and day out will be encouraged and supported. If you feel you cannot support these evidence-based public health measures, I would ask you to consider carefully if your service on this board is appropriate. We're in this together, and I'm thankful for your service, and I hope we can continue moving together as a community.
Next, we have Tara Lee.
She already spoke, so.
Oh, good catch.
Twice, I mean.
Once is probably enough. Gabrielle Rogers. Do we have a Gabrielle? And then Scotia's on here twice too, but I did see a name, someone with that name log on. Sarah Scotia Brosnan or Brosnan. Okay, last we have Lisa Heil.
I guess I get to close this. I also want to thank the board for the hard work that must have gone into finding a new health officer, and say how much I appreciate that, and how relieved I was to hear that Governor Bullock did put some restrictions in place. And my biggest concern is if they're going to be enforced, because we have not seen a lot of that happening, and we cannot deny the critical situation. We just had to call in help from the National Guard. So I don't think anybody can deny that anymore. And I just want to urge you to do your utmost to uphold these restrictions. My biggest concern continues to be these super spreader events that are coming up at the fairgrounds. And the way it is written, it looks like they can just come up with a plan for social distancing. And I think that we all know, based on what we've seen in this community, that even if they have a plan in place, that's not going to happen. And I really, truly believe that these huge events coming up at the fairgrounds need to be canceled. And if the new health officer and the board could have anything to do with upholding that and getting these events canceled or severely restricted, I think that's crucial to keeping schools open, to keeping businesses at least partially opened, or I just think we're going to go over the brink with these events if they happen. So that's all. Thank you.
Bill, you're muted.
Unmute.
Hey, Bill, can you unmute yourself?
There we go.
There you go.
I am unmuted. Thank you. I do have a citizen comment. I've observed this board in operation for almost 3 terms. One of our members, my first data point is nearly 100% attendance, and today he's not here. So it's still nearly 100% attendance. He is out of town on business. That's Roger Noble. He's been a very positive contributor for 3 years. His term is up. And I think that the rest of the board would join me that saying that he certainly earned the opportunity to be reappointed. And that's my recommendation to the 3 commissioners. He's been a wonderful colleague. He's been a positive, fact-based, evidence-based decider. And I certainly support him, and I encourage my colleagues to do the same. And if there are no more comments, okay. Next is the Personnel Committee. Kyle, do you want to take that up right now?
Sure, I'll take the lead on this one. Thank you,
Okay.
Mr. Berg. So I do have the situation where I do need to share a new recommendation from the Personnel Committee. This is, at our last meeting, we did take an action to enter in negotiations with an individual. And now I'm at a situation where I need to make the follow recommendation, which is that the Personnel Committee would like to recommend moving forward with Brian Hanf to negotiate an employment contract for Chief Health Officer.
Okay, you are the chairman of the committee. That does not need a second.
It does not need a second. I can speak to that and give a little bit of discussion.
Would you please?
Sure. So as I mentioned, I mean, we are in a situation where we are in negotiations, moving forward with a second candidate to also enter into the negotiations for this Chief Health Officer. You know, these are difficult times to be recruiting for this position. We have received comments from the first individual that are going to, that would, to public comment, let them know that they are watching us. And that they are engaged in this process. we are also, so that's sort of where we are of looking at needing to enter into negotiations with the second candidate. And then I'll have some conversations for the personnel committee regarding compensation and relocation to be able to move forward with those conversations. But happy to entertain other questions, but also this is a motion that's on the floor and would love to have the action taken.
Is Ronley active on the call right now?
I believe she is, yes.
Are there any other questions or comments? Are you ready for the question? Kyle, would you restate it?
Sure. The Personnel Committee would like to recommend moving forward with Brian Hanth to negotiate an employment contract for Chief Health Officer.
All right. Carrie, would you call the roll?
Bukacek,
Abstain?
Berg,
Yes.
Hybar,
Enthusiastic, yes.
Larson,
Yes.
Skis,
I
Ronelli?
think I saw her iPad said it left. Is she still on?
I just got a message from her that it, yeah, something happened. She fell off the call.
She's joining back on now, so I'll come back to Ronelli. Waterman?
Yes.
So we actually need one more vote, so let's hope that Ronelli is... Oh, Larson, did I not call you?
Ronelli,
I just got back in. The Zoom kicked me out, and I just got back in. So what is the vote again?
Ronelli, the Personnel Committee would like to recommend moving forward with Brian Hanf to negotiate an employment contract for Chief Health Officer.
I would like to vote yes on that.
And Artis, I'm sorry, what were you saying?
Pam had sent me a text message saying she couldn't get on Zoom, so she was going to call in. She had the phone number to call, so she might be in the midst of the phone calls to participate in the Zoom meeting.
Pam, can you speak up if you're here? So Bill, I have 5 yes votes.
5 is all we need. We have a total of 8. There's 1 abstention, is that correct?
Yes.
So it's 5-1 with 1 abstention?
Yes.
And Roger is missing, so that certainly is a favorable vote. It does pass. And thank you, Kyle. From all of us, we know what the heavy lifting has been going on for a couple of weeks and beyond. Yeoman work. Thank you.
Thank you, Mr. Berg, and thank you for the public's understanding and patience as we move through this process. I mean, it is not over until it's over. So wish us all well. We will share information as we get to a contract that comes to mutual.
Okay, and I understand you've called a personnel committee meeting for tomorrow?
I have, so I mean, personnel committee will have, we are continuing to move forward with the conversations. Again, this is a negotiation process, so we have some certain items that we have to identify. Again, my goal would be to let the public know and let the rest of the board know once we come to mutual with a candidate that we're able to announce and share the details of who that candidate is.
Okay. And is the time and place firm at this point? 2:30 Friday is the last I remember.
That's what I believe it is.
Okay. Well, thank you for your good work again. Next on the agenda is approval of the minutes of October 15th.
Bill, I move the October 15th board minutes for approval.
Is there a second?
I'll second that.
There were two ones. I wasn't sure what it was. I'll accept it as a second, but at the same time, I think there were some corrections that Dr. Annie wanted to include. Am I correct in that, Dr. Annie?
Yeah, the corrections didn't happen. There probably wasn't enough time.
These are corrections to your testimony. Is that correct?
Yeah, I didn't really request corrections. I just said they were inaccurate and recommended something a little different. But
Okay, well, I think I responded to you and said that if there are corrections, you can submit them to Carrie and they'll be included in the minutes unless they're wildly wrong, and I'm sure that's not the case.
right, and I didn't want to go back a month trying to remember precisely what I said. So.
Okay.
Thank you for the opportunity, though.
All right. Well, they're always correctable, and there's another topic we'll bring up in a minute about whether we should have written words or not. So, is there any more comments? And if not, I'll ask for a vote. All in favor of the minutes as published with possible corrections, say aye.
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 Any noes?
I'll say no.
Okay.
Just one person.
All right. Send the corrections as in, and they'll be made part of the record. Next is the approval of the minutes of our special meeting on my birthday, November 2nd.
I move for the approval.
Okay, there's a motion. Do I have a second?
I second.
Well, thank you, Kyle. Is there any discussion? Hearing none, let me call for the vote. All in favor of approving the minutes November 2nd, please say aye.
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 And I am an aye as well. It's unanimous.
Or just,
So,
I
I'm
have
sorry.
I have a nay for that too. Just one vote, nay.
Oh, I'm sorry.
That's
Artist. All right. It's 5-1 and they still pass. Thank you, Artist. And we'll go on
No.
to the, oh, there was another no.
No, that was Amy. I voted yes for.
Yeah, Mr. Berg, the dissent came from Dr. Vukacek.
Okay. They still pass. They are passed. Let's see. We have committee appointments.
Do you want to talk about the minutes, Bill?
Oh, yes. Thank you. It was recommended, given there's a substantial effort put forth by the staff to record these minutes in written form, could we substitute something else like the video recording or the audio recording and not do the minutes? The answer came back from our attorney in the county attorney's office, in which it is a state requirement to have a written record. So that has to continue, but we can post or make available the audio recording. I think that's meritorious. It's worthy of discussion. Is there any objection to that? And if there is no objection, Carrie, can you see that happens?
Yep, we'll start posting the videos.
Okay. And
I do have a question about that. If we're not documenting, are we documenting the motions as well as the votes, just not documenting anything that is not a point of personal privilege? Is that what the plan is, or are we not documenting anything for the minutes?
So we still have to do minutes. So they'll still be written minutes. This is just to also post the videos in addition to doing minutes.
Okay, thank you. And I guess, do we have to be really specific on the comments or a generalization of the comments in the minutes, and then the posted video will take place of the specifics, so long as we are documenting the general presentation as well as the motion, the specific motion, and the vote as the motion falls?
So that is at the board's discretion. We have moved towards more of a transcript type approach based on feedback from the board. If the board would like to move away from that for its minutes and have only action items recorded and any key points. It would save staff time. So we're all for it. It's up to the board.
Thank you for the clarification.
And I would just like to say, I mean, for city council, we are going for that latter motion, and we're sort of documenting general subjects, but also sort of leaving a timestamp, I believe, of where it is in the video that our comments are made. And we're not taking the staff time to detail those out. And I'm comfortable with that sort of move. I do know that it takes time to transcribe, but I would also encourage board members to remember that we are on a video call, and that when we can, we should turn our video on so that it's easier to see what people are saying and what the tenor of the conversations are.
Could I just add so that the board members are aware? I'm happy with that change. Again, anything we can do to save staff time is good. The minutes do use transcription software. So somebody goes back through to edit them because the software isn't always so smart and some silly things get said. But it is a transcription software that is giving us the basis of what the minutes have become. So we'll make a change and we'll move forward. So I'm hoping that will
sounds like
help.
a great idea. If the video's available and then you just cover the action items and key points, that would seem to make the most sense. So do we vote on that? Whether or not to make that change?
We don't have it as a, this is really an ad hoc issue, but we can put it on the agenda for next time.
We could just do it.
Just do it would be wonderful.
I think so. It's within Carrie's authority as the deputy to do that.
Terrific. Thank you, Carrie.
Okay, what's our next item?
Can I say something? I have a Bill.
Yes, go ahead.
Pam had just told me that she is on the line but she's muted. And so Carrie, I think it's her cell number. It's the 250, I think it's 8016. So that's Pam's number. So she says she's in on this meeting.
Tori, can you find her and unmute her?
Yeah. So she's the 250-8016.
Yeah, unfortunately, when I'm sharing my screen, I can't see people.
You just sent me a message
So
saying.
I have asked her to unmute, but it's not allowing me to do it on my side.
Okay.
So Pam, if you can hear us, unmute yourself and let us and say something so we know if we can hear you.
Well, she's only 2 buildings away. Shout louder.
Ned also shared, Pam, if you can hear me, press *6 on your phone. And that will do the same thing. Thank you, Ned. Apparently you know the shortcuts.
Prime dinner in the house.
Hello?
Oh,
there we go.
Can you hear me now?
Yep.
Oh, good.
Loud and clear.
Oh, that's great. Okay, thank you.
Okay, welcome aboard.
Yeah.
If your screen is up, we've just switched the screen to committee appointments.
Yeah, actually, I'm on my cell phone. I can't get anything to come up on my email, so I'll keep trying, but thank you.
We have committee assignments. In the Environmental Impact Committee, Roger's the chairman, Artis is on that. We only have 2. We'd like to have 3, so it'd be nice to have another volunteer. All you need to do is let me know, and we'll put you on the committee put you on another committee if that's the case. And if you want to be relieved of a committee assignment, we'll do that well. The only one that at the very bottom is Roger Noble. That's a 1-person board where you're sitting on another board so that we have a good communication between the two boards. So at this point, I think there's nothing other than announcing that we can appoint new people to committees, if you'd like. Typically the number is 3, so just let me know. Carrie, anything else on this one?
Just a reminder that you can't have more than 4.
Right. Okay, thank you. Okay, the COVID update. I'd like to start out, if I may, Carrie. Can you go to the county website at which the number of cases and deaths and the graphic is shown?
Yeah, that'll just take me 1 minute.
Okay, and in the interim, a month ago at our last meeting on the 15th or 16th of October, 15th of October, about an hour or two before the meeting, I created a graphic in number form, and you've all seen that. Now let's see. And I want to show you where I took the information. I've presented it to this body several times. I've presented it in part to the commissioners, and Pam, you've seen it multiple times. I've only had one complaint, and that was from one of the commissioners who I think really didn't understand it. I don't see the graph there, Carrie. Can you get the picture that has the graph? That's part of it. There it is. No, that's, well, that's a different one, but it's, no. That's not the right one.
Which one are you looking for?
I do a search on Flathead County Health Site, and then I go down a half a page, and there's a COVID data listed.
Let's see. We have a couple pages of data. Are you looking for a chart?
It shows a graphic of COVID cases historically, the number of recoveries, and at the very, very bottom, almost imperceptible to see the number of deaths.
I'm sorry, my internet is really slow to load. Let's try this again. Are you looking for recoveries and deaths? But you're looking for
well, I can use the graph below there to illustrate. It's not the same. There you go. That's it. That's it.
Okay.
Okay. Everybody, look at that graph, if you will. It's curvilinear upward, which means it's an exponential function. There's a portion of it in the first few months that you can't even read because there's so little data. There's an area between the middle of July and the middle of September. I'm looking at the red line, and you can see it very clearly bend, and it goes up a couple of months and wiggles back and forth. And then at the very right-hand side, it seems to be bending upwards again. The green line is the number of recoveries, and new cases. It's very difficult to read, but if you added all the new cases up, historically, year to date at any point, that would be the red line. Now, when I'm looking at this, you can see the grid lines, both the time left to right and the number of cases, which are vertical. And I've been looking at this for over a couple of days, but in the 2 hours before our last meeting, I looked at the graph at let's pick the middle of September, and let's look vertically from the E in September. And that looks like to me, there you go, and go up to the red line, and you can see it's just below 1,000 cases. Maybe it's 850. The red line itself is probably 100 cases wide. So let's go back a month, right over the U in August. Everybody do this, you look up. Well, the grid line that shows above it is 1,000, so maybe that's around, looks like a little bit half, so maybe that's 450. Now let's go to the U in July. A little bit to the left, and I hope everybody is following this. That looks, you know, that's maybe, it's less than a quarter, so maybe it's a little less than 250, so maybe it's 200. If we go back to June, go over the U in June, it's so skinny, you can't tell. So now let's go over to October. And let's pick the C in October. Just above 2,000. And I think some of this has been updated in the last month or so. So this is not quite the picture that I saw, but it's pretty close. But you can see it's over 2,000. And that's what I saw. So 250 to 500 to 1,000, and it was approaching 2,000 in the month of October, which was the day that I created this graph. So what's the error bar? When you're looking at something like this, how far could you be off either horizontally, plus or minus a day or two? I think you'd all reach the same conclusion. The plus or minus a day or two, it's pretty hard to tell. And vertically, it's also hard to tell. The red line approximates about 100 cases vertical. Now, can you go to my graphic that I sent an hour ago? And if you think I'm rubbing your nose in it, I apologize if you understood it. There were some people that didn't understand it. And those are the folks that I'm speaking to now. So this is what we saw then. If you go up, show the upper left-hand corner, there we go, Flathead County COVID projection. I put the formula in there. Total cases equal 250 x means times. T to the hat 2 is the way to write t squared. 2 times 2, 3 times 3, or whatever it may be, where t is the period in 30 days. So we looked at how I developed this theory by looking at the graph. It appeared to me it was doubling about every 30 days. So that's what I put in column G. I also put over on the left-hand side, the base is 2, 0 period, first period. The growth factor, since I'm saying it's doubling every 30 days, 2 to the t is 2 to the 1, or 2 to the 2, or 2 to the 3 is 4, all the way down. T to the seventh power is 128. So I put in the box what I visually observed, 250, 250. The first 250 is history to date as of the 15th of July, 250 for the next month, 500 for the next month, and 1,000 for the month that had just been completed, mid-month to mid-month. And I was projecting that we would go from 1,000 for the month to 2,000 cases, the number of cases doubling. So in column F, you can see the total number. Obviously, you subtract one from the other, and you get the cases that I was projecting. And that number didn't turn out to be 2,000, which is what I was projecting. It was 2,949, almost triple instead of. So let's go down a page, if you would, Carrie. Page 2, and that's it right there. Mid-October to mid-November. These numbers were taken from the website that we just looked at. It started with about 2,300 cases. That was a guess because I created this part of it later, a day or two later, and I couldn't remember what it was, but it was close to 2,300. The next day, which was the 17th, there were 2,347, and you can see the total number of cases in column F. Column G is the arithmetic difference between the two. Over in column I is the running total. So 47 in the first, in column G, plus 56 is 103. And then I use the calculation of the number of cases in the month divided by the number of cases, or pardon me, not the cases, the number of days behind us. In this case, it was a 31-day period. between the, if you go down, scroll down a little bit, from October 15th to today is 31 days. The very last day that the data was available, this is 2 days ago, on Tuesday, we had 5249. We had 137 new cases. It's the end of the period. So if you look at the yellow column, 2,949 is the projection, because that's exactly what it was. Now let's go down a little bit further, and we'll go to we've had 2 business days, November to December. The data was posted at about 12:30 this morning, an hour and a half before we started. So 5249 has grown to 5337, 5488. And that's where the projection for this 30-day period comes from, 3585. And if you go back up to the top, Carrie, if I connected it correctly, we should see that number. There it is, column G, 19. Now, the criticism that's been leveled, and it's only one person that's done it. There may be some out there listening today that did it as well, but the only person that has done it, when we started, I showed him where I got the information. It was a county website. His information was from the state website. Lo and behold, the numbers of cases were exactly the same, and the number of deaths were exactly the same. In column F, I put a little dialogue box, the deaths in 8 months prior to 10/4/23. We agreed on that, but it appeared without that we had 23 in 1 month, and that was clearly wrong. And at the time we were speaking, I think we had the 4 cases had already happened, so we agreed on the total number. But displaying 20 in 1 month was a reporting issue that I hope I've corrected now. Also, if you go down a little bit further, you can see the dialogue basis box, which explains where other numbers have come from. And you can see the estimated, on line 23, the estimated error beginning mid-October are estimated there. We looked at the graph. There were errors in picking the data both left and right on days, and there's errors in how wide that line that we looked at. So with the information that we have today, sitting here today, the actual data, which is shown in yellow, and I'll call it buff, not sure that's the right corrector, 3585, are for the projection. When we're sitting here next month, 8535. The difference between that is 98 cases, which are in the yellow. If I had a more precise measurement technique, which I didn't have, those numbers in yellow would have been slightly different, but collectively there's only 98 of them. And by the time, if my projection is correct, and it is a projection for 28 more days in this period, by the time we'll get there, 1% of the 9632 is explained by the starting errors. So that's where we are today. We went from 1,000 to almost 3,000, and with 2 days experience, which is not very good. I mean, it's subject to variations. It's not very accurate. It may go up, it may go down, but based on the history, it's probably where we're going to be, and it's probably going to be low. So we're in the middle of a pandemic that is the accelerator. The foot is still on the accelerator, if we can use an automobile metaphor. And it's increasing, not at a linear rate, but at an exponential rate. And within that exponential, that number is increasing. It's not squared. It may be at a 2.2 or 2.3, at least on the history for the last couple of months. So I invite anybody's comments or corrections, or am I stumbling through this?
I'm Carissa. I have a comment with, the numbers going up and down, because I used to be the COVID screener for the Evergreen Junior High.
Can you go down and show that? Carrie, go down to page 2. This is what you're talking about?
Yeah, because with like the schools, we'd have to, update daily and it would go up and down. It's just a lot of people don't know what to do in a pandemic. I have previous medical, experience, and so I was able to keep everything level number wise. But what I noticed is a lot of people are scared. They're not thinking clearly, so it's the numbers fluctuate in that aspect too, because a lot of people don't know what to do, how to calculate. And that's where, plus with people not taking this seriously, it's going up. I was just grateful enough people were actually listening to me enough to keep everything level, because no kids were actually considered positive when they got tested. But I am surprised at how many people don't know what to do with when a pandemic hits and how to calculate numbers.
Well,
I'm just glad you guys do.
This clearly illustrates the point. The numbers do go up and down.
Yep.
If we were going to, let me do an analogy. There's Newton's first law says that a body will remain at rest, which means going in the same direction, unless acted upon with an outside force. And the simple analogy I'll use is let's get in a car that has a big engine and an accelerator. So we can put our foot on the gas, the accelerator, and it will start moving. And let's say the acceleration component is 10 feet per second per second. After 1 second, 10 times t, 1, you'd be going 10 feet per second. The formula for how far you're going to go is 1/2 t squared. Well, if it's 1 second, 1/2 of that is a half, and if you multiply by 10, it will have gone 5 feet. If it's, let's say, 5 seconds, well, let me pick another round number. It's 4 seconds. T squared, after 4 seconds times t, you're going 40 feet per second. And the distance would be 40 t squared. T squared is 16 divided by 2 is 8. Times 10 is 80 feet. So each increment of time, you go further because the acceleration is the same. What I'm suggesting here, the acceleration component is not constant. It's faster than squared. Carrie, you studied all of this for years and have a master's degree. Do you agree with that concept and in concept?
Yes. So I think we want to keep an eye on how fast the curve is changing. So I know that was a lot of numbers and maybe a little daunting for some of the folks. But I'm hoping that the point came across that we're looking at the projections going forward. So we want to see what's happening to the curve. And when we look at the curve, it's increasing more sharply than it was a couple weeks ago.
Absolutely correct. If people think back about February or so, when most of the cases were in New York, and you heard Dr. Fauci and Governor Cuomo saying they're trying to flatten the curve. That's where the exponential is less than 1, and they eventually did get it flattened, and now it's more than 2. So if you think of the shape of that, flattening the curve, the steep portion that flattens out and eventually went down, and then the virus came back, and it's coming back with a vengeance. And there are a lot of moving parts. This is a very simple model. It would work with a car. It doesn't work with a pandemic because there's so many other moving parts, like getting together in large groups, inside or outside, and being responsible for yourself and your family. And add to not being stupid. I know stupid is congenital or it's infectious. But around here for the last month or so, it's both. So that's the end of my mission. So let's go on to the rest of it. What else do we have in store?
Comments?
So,
absolutely.
Okay.
Let me turn it to Carrie and ask, is there anything else that we have formally? I want to ask both doctors about their experience and what's happening in the hospitals and any guidance that may be derived from that. So you can take this down, and I've accomplished my objective.
So it should go next to Pete to talk about the committee and any updates he would want to share.
Okay.
Yeah, thank you. Can you hear me okay? Can you hear me okay?
Yeah, I can.
Yes, we can.
All right. So yeah, no, thank you, Bill, for walking us through those numbers. Obviously, pretty grim picture as to what's going on in the Valley right now. And a couple just big picture things that I would note as also a part of that is we also nationally we're at we've passed the milestone of 250,000 deaths from COVID in our country. So we are certainly spiking in a dramatic rate. We're not the only place, but we are certainly one of the steepest rising areas right now. And then also looking at the capacity indicators that's published from the health department that's linked in on the agenda. If you look at under community prevalence, that second line over where it's showing your positivity rate. And so that's also not only are just more people being tested as they should be, but that we're also seeing a dramatic increase in the positivity rate over time. Yes, wanted to share that. I will say, as a practitioner who's taking care of people on the front lines in this, right, we're getting to the point where people who would typically meet hospitalization criteria, we're telling them to go home. People who would typically go in and oxygen therapy right now are some of them, and it's reasonably so. It's not an unsafe situation. It's not a irresponsible situation, but it is critical to the point that some people who would have respiratory distress to the point that they would require oxygen we're now doing oxygen therapy at home for them as they are trying to convalesce from this illness. And it's not just the deaths, but we're also seeing again many of these patients who continue to be significantly ill and have a decrease in their lung function weeks out from the illness. So it's not just you get through it unscathed or you die. I mean, there's people who are suffering significant consequences long term from this illness. So that's what so that's a little bit of just my firsthand experience and what I've been seeing in my patients and the work that we're doing here at the clinic. It's just for a little bit of boots on the ground kind of what we're seeing in taking care of patients with this disease. And then so just specifically to a couple of things that we're working on with the committee to try to support the health department. Number one, we really appreciated the work that's being done up in Whitefish, and I want to put a kudos out to the task force and up there who is really trying to work on a PR campaign, because the point is we really need our community to hear this message that that we need to change our behavior in order to get this under control. And so we've been hearing a lot again from the task force up from Whitefish, and we appreciate what they're doing, and we're supporting and trying to partner with them in their efforts. And then also wanted to speak briefly, and then also working on trying to help the health department to get ready for the vaccine rollout when it does become available. I mean, I think the point being that we are in a very difficult situation with the disease prevalence in our community. The good news is that the vaccine does look like it's getting closer. I mean, it's not going to be here tomorrow, but it is getting closer, and so I think that's hopeful, and that it makes it easier for those of us. It does make it a little bit easier to say, hey, let's buckle down. Let's continue to do the hard work of, maybe of not going to big groups and meeting with other people and keeping those social interactions significantly limited through this season, and know that this is going to get better, but if things don't change, it's going to get a lot worse before it does. It's not going to go away magically on its own. So that's what I have to say.
You have the gavel and the you're running the meeting now. So anybody have any comments?
Are there any other questions are there any other questions for the COVID committee? Or comments about what we're
I have one.
All right. Well, you have a great weekend.
What ways can we help with getting other people to change their behavior, or not really behavior, but their thoughts? Because a lot of people are having such negative thoughts with it. What can we do to help change their mindset?
That's $1 million question. I think there's a certain demographic in our community that remains in denial of the severity of this. I'm at a loss, and it's not just here; it's countrywide, of knowing how to reach those people, and I don't know if we can convince that a certain demographic, that certain area of the population. I think and so where we, I think, need to focus our efforts is on the groups that are willing to do what's necessary. We just need to empower them, trying to reach them and empower them with the information about how to keep their employees safe, how to explore how to do things to try and keep their businesses open so that they can remain afloat, but to do it in a safe way that decreases the exposures of not only their employees, but then also the patrons that come into their places of business. But that question of how to reach the skeptics is one that I don't know if anybody's gotten a good handle on at this point.
Hey, Pete, we have two attendees who wanted to ask a question.
Okay.
So Marie, you're up first.
I was just wanting to know a little bit more about kind of what recourse folks have in different sectors. So as consumers entering a business, obviously I know I have the choice to leave, but what other recourse do I have in terms of reporting or otherwise kind of indicating that, there's a business that's out of compliance? And then secondly, what recourse do businesses have? Because I know a lot of these It's not so much the case for corporate or larger entities, because I think they have corporate backing and kind of some force behind that to motivate them towards the difficult conversation with patrons who may not want to wear masks. But what about small businesses who may be just fatigued at this point and desperately kind of trying to keep their businesses afloat? What can they do to look for support to foster mask compliance?
Yeah, no, thank you. Thank you for the question. We are still operating under the governor's mandates, and so when places, obviously, right, if you feel unsafe and a business is not complying, you can choose not to patronize that. You can choose not to patronize that business. And for repeat offenders, there is a way to make a complaint against those businesses to the health department. And so Carrie, correct me if I'm wrong in that.
That's correct. When a complaint is received, it goes into a database. There's a process, and education follows. We've talked more about the process in the past.
Yeah. So there is a recourse for there's a recourse for patrons, who have gone into businesses and feel and the adherence is low with the recommendations, and so there is a place for that. I know it's fatiguing. I know it's hard to I think keep advocating for yourselves and trying to do so in a generous manner.
And Pete, there's also it looks like Ron, who has his hand raised.
Can I go ahead, Pete?
Yeah, go ahead.
Yeah. All right. So quick things. I sent a chat to Carrie. One of the things, and this refers back to Bill's very helpful chart analysis and whatnot. I think one of the things that could perhaps decrease the mass of numbers a little bit would be to try and get to a 7-day rolling average on this stuff, which would show the line and avoid that one day up, Monday down. I mean, the Monday jump or decrease on Friday for numbers. The 7-day average kind of comes to the same point, but with a little less confusion. But I haven't seen that for, and maybe it's because I missed it, for Montana or for the Flathead. But I think that would be really helpful. What can be done about that, I have no idea. But I was going more to the point of the board itself, and I'm very frustrated by the general lack of initiative and the buck passing between commissioners and the board and the governor. And, it really is, folks, I realize your job is tough, and I don't understand, but I know politics is an umbrella under which you all operate. But let's get real here. People are getting sick. Our infrastructure is getting tested to the max, and people are dying. We've got to be more proactive. When we have a frustrating message to get out, and that is that this thing is real and masks and hand washing and social distancing work, we have so much, and unfortunately I'm not a denizen of it, but social media out there that can be used to bombard people. If we're using it for bombarding on politics, can't we use it to bombard on health-related issues, which are equally or more important in the short term? I mean, it just seems to me that it's a lot of, hand-wringing and, frustrated speech, but there've got to be ways that you as a board, the commissioners as a group, okay, they can't decide, let them do what they can to better inform and get participation that way. It will work. It will work. work. It has to work. That I don't believe that our population is that stupid, but they are biased, they are opinionated, but they're not stupid. Okay, I respect my colleagues, you know, my co-citizens, whatever their political ilk, whatever their education level. People are not stupid, they're just not getting the message, and that's your responsibility, to be frank. Sorry, I went on too long, but anyway, thank you for the listen.
Yeah, thank you very much for your comments. Let me, I guess, address a couple of those, if I may. I think the first one would be, I think Carrie just put up on our page right there. If you look at those, the graph that she's put up, that is a 7-day. I think it maybe have been what you're referring to as a daily average by the week of cases, and so I think that may I don't know if that answers your first point about looking at 7-day moving averages. I don't know if you can see that. So that was your first point. Second point,
I can see that, but Carrie, where's that from?
That's from the health department. So this is up on our website.
I got it. I can see it. It's teeny at the top. I got it. Okay. Thank you. Sorry for the interruption.
So I hope that's helpful for you and addresses that first point. You know, the second point, social media and getting out the message. Yeah, we are, as far as that's concerned, social media, the inherent, obviously issues with that are you can bombard people, you end up preaching to the choir. People hear what they want to hear and go to the social media sites that that just make their beliefs even stronger. I don't know, what else that would look like, and I'm only speaking to my experience on that. As far as other ways to get out the message, Tamale just released a statement from the health department. Earlier this week, giving specific recommendations for travel, for travel, but for the holiday season and for getting together with loved ones and things that we can do to, if you're going to choose to gather with other people, trying to do it in ways that is as safe as possible. So the health department is putting out announcements, and we are in support of Tamale and the announcements that she has put out. As to your frustration with the board and our inability to enact additional mitigation measures, there's a number of us on the board that I think that have been frustrated with that as well. But we are also a board of currently of 8 people, and the board has to this point been split on enacting further measures, and so that's where things stand at this point. And I think I addressed all of your points there.
Is this the point where I make my comments, or would that be another?
Yeah, if you want to, I believe so. Sure.
Would that be appropriate, Carrie?
Yes.
Okay. I wanted to address the skepticism and really a kind of a general lack of trust. And I appreciate Ron's comments. I mean, the people that are skeptical are not unintelligent. They're not uneducated. They do a lot of their own research, and they would consider their opinions to be fact-based and science-based as well. And I've gone through some of that. A lot of the lack of trust, the skepticism, is based on how, COVID-19 has been rolled out. Early on, when the media and the hospitals and many doctors were promoting fear of this virus, the hospitals were basically empty. and so are close to empty, and a lot of the patients that were being admitted wondered why they were there. So that created some distrust. And the other thing is the unprecedented use of the word case to when it refers to a positive test. It does not refer to somebody being sick, and it's unprecedented in this country in the history of medical care to call a positive test a case. And anybody seasoned in medical testing knows that we don't do birdshot testing where you just shoot it out there for symptomatic and minimally symptomatic people. We use medical testing historically, much more intelligently than that. There's a tremendous amount of skepticism about the PCR testing, and I think that's a big source currently. And there are lawsuits springing up internationally about the harm done from lockdowns that are based on inaccurate testing. So that's not my idea. It's going on internationally. And Dr. Pete had said, one thing, there have been multiple requests to correlate any of these numbers on positive test or cases with the number of tests that have been done. And not only have the number of tests in Montana and in the Flathead exponentially increased, but also that increased positivity rate that Dr. Pete talked about. The MSU lab, in an article, I think it was October 9th in the Missoulian, they admitted to having a PCR cycle threshold of 40, and they opened their lab and started, the massive number of tests increased after that lab opened. And if you look at the meaning of cycle thresholds for PCR testing, Dr. Fauci himself has said that cycle thresholds of 35 or more, what he says is, quote, not replication competent. And he says you can't tell if the tissue that's being amplified this many times is dead or alive, or what the meaning of it is. So the skepticism about PCR testing is very much warranted. There's science behind questioning the value of PCR testing in this case, including when the viral sequence is not clear, but even just based on the cycle threshold rate of 40. And the MSU lab admits to that. So that the PCR testing in and of itself, that's the basis for our calling a test positive. And so that's a real big deal. These are not uneducated people that are concerned about this. It's physicians internationally, attorneys that are involved in those lawsuits. And so, and the other thing is, in terms of comparing, I mean, we're right in the season for viral syndromes and people getting sick from viral syndromes. And because of the way the rollout has been, we don't even have a good way of comparing this to last year or the year before very well. And anybody that's lived long enough can remember, entire classrooms. I had a patient telling me, she's in her 70s, she said when she was a kid, sometimes an entire classroom would be homesick. So we don't have real good, comparisons. And I would like to give some information about complicating factors in an analysis of the hospital situation. And that is, if a patient qualifies for remdesivir, for one thing, remdesivir is not specific for a novel coronavirus. There's been research on remdesivir going back to 2009, and in 2014 they talked about testing, using it to treat Ebola. So it is not specific to any virus in particular. And if somebody that's hospitalized qualifies for remdesivir, that adds 5 additional hospital days. So whether they, we could come up with a more intelligent system or better utilization where maybe these people could be treated at home. The fact is, many of them don't necessarily qualify for hospitalization, are not sick enough to be hospitalized, but 5 additional hospital days is being added. So you multiply that times the number of people that qualify for it. That's a lot of hospital days that are being taken up potentially with patients that don't need to be at the hospital. The other factor that needs to be taken into consideration when we look at the hospital that it's overloaded is that previously, prior to the COVID rollout, so prior to March, patients who, for whatever reason, their age or underlying debility, for whatever reason that they weren't quite ready to go home, they would go to Brendan House or a rehab center so that they could recoup and get their strength back. And from last March, if from my understanding, is that those places that would take those people, they won't take somebody who's COVID-19 positive. So the patients have the option of either being sent home or staying in the hospital. And previously with, CMS and Medicare and Medicaid, payments, hospitals were encouraged to get people home as soon as possible and make things efficient. But that's no longer being emphasized, the efficiency or showing how it actually is required that this patient be in the hospital. So those are two factors that I'm very aware of that are complicating the whole hospital analysis. So I think that's important. And again, since that lab with the 40 PCR cycle threshold in Missoula, since it opened up, we've been testing 4,000 to 6,500 people per day in Montana, 350 to 500 last time I looked at the numbers in the Flathead. And any medical test that you could pick, if you're testing 4,000 to 6,500 a day, that test is going to create meaningless positive tests. So back to the original statement that I made, people have reason to be skeptical, and it's not based on ignorance or emotion. It doesn't seem to be, at least the people that I talk to, it's not politically motivated. So I think I'm done for now.
Pete, I have a follow-on.
Yeah, go ahead.
Dr. Annie, you speak rather authoritatively about what's going on in the hospitals. Do you have patients at the local hospitals?
I can't speak with authority on what's going on in the hospital. I would be happy to do an analysis. I have I've done peer review in the past, and I'd be happy to go. I offered that to one physician and haven't heard back on that. So I can't say authoritatively. I can say I had one patient who tested, and I know the case very well, tested COVID positive, when it was in for 2 days, and then did not want to stay the additional 5 days and was sent home and is doing fabulously well. And so I do have that experience, and I have the experience of a patient who, I've talked about this one before, had a fracture, went to the hospital, tested positive. They seem to be testing, possibly everyone that gets admitted, possibly everyone that goes to the ER. She was tested positive. She had no fever. She had no symptoms. She was put in isolation on the COVID wing because her oxygen level, even though she's in her 90s, her oxygen level was 99%. She didn't qualify for remdesivir, and she also was sent home in 2 days. And my experience is this year, to this date, I have not had any patients die of any infection whatsoever. And I had the one patient who was admitted, and rightly so, for a low oxygen level, and she had tested COVID positive. And I'm an internist with generally an older population with a lot of comorbidities. And so I think it's probably a fairly standard internal medicine practice, and my patients have actually done better. And I don't think it's than most years. And I don't think it's anything that I've done. I think it's because of some of the measures, like people who are compromised staying home more.
Okay, well, let me focus on one issue. Is it correct that you may have one patient, one data point that has been admitted to the hospital here? Hospitals, either hospital?
Well, I've had patients admitted for other things. I had a patient who was admitted for COVID. Is that what you're asking? That was
well, do you have admitting privileges on both hospitals here? Either one or both?
I only do outpatient. I do outpatient.
Okay, so is it correct you don't have admitting privileges?
Correct. I don't see patients in the hospital. I haven't for probably 15 years.
Okay, thank you.
And you're not currently on the peer review at the hospital, are you?
No, I have offered to be.
But, okay. But you are not currently on peer review at the hospital. And
That is correct. I've done quite
and so, I mean, I do think that we have to be cautious of speaking about what is happening at the hospital if we're not really seeing that firsthand. I have a couple of questions, if I might.
Who's that fucking idiot?
Yeah.
So, I mean, regarding some of the questions regarding positivity and what our cases look like, positivity rate, usually when it is high, it means that we need to be doing more tests. It's not because we're doing more tests. Is that correct, Pete? I mean, is that sort of an assumption?
Ask your question again.
Could you just explain positivity? Like when the positivity rate is high, what is that sometimes telling us about our testing samples?
Yeah. So I mean, when the positivity rate is high, then that speaks to how likely somebody is going to be having, for each test that we do. It speaks to how likely that person is going to be positive when we test it. So it's not just we're testing more people to find, to go out and look for ways to increase the numbers. It also speaks to the fact that as we're doing numbers, the rate of positive tests has gone up. So that speaks to the causative reason why our incidence in the community is up so high. And then it also, as the and how much, and then right, as I think as your point being, then tells us only that we need to be trying to test more because there are more people out there that are perhaps symptomatic or asymptomatic or minimally symptomatic that are still able to spread the disease.
Yeah. So, I mean, I hear this sort of comment that, we're seeing more tests because we're seeing more positive, we're testing more. That's why we're seeing more cases out there. But my understanding a little bit about it, as I've been looking into positivity rates and stuff like that, is a high positivity rate actually might just mean that we're not scaling up the number of tests that we should be doing.
Right.
We're running across that we're doing tests and we're seeing a high positivity rate. That would actually mean that there might be more cases in the community than what we are actually testing.
That's correct.
And that, that to really get to seeing how testing works, I mean, you'd be scaling up until you start to see the positivity rate sort of average off. And then you would be able to say, hey, we're doing this right level of testing for this community. But right now, positivity rate is telling us there's more cases out there than what we're currently seeing.
Yeah, or if our positivity rate or if the rate of our positivity is related to our rate is similar, if our positivity rate is low, but the numbers keep going up, then that would speak to that.
And I appreciate, Bill, you're looking at the test. I would just like to note that as a board member, when we first started talking about any restrictions in the middle of September and we're looking at numbers, we were trying to keep our caseload. I believe the goal was to get under 50 a day. And at the first times that we first had some of these conversations about that seemed actually fairly doable. That we could say in the middle of September we might be able to flatten the curve and get ourselves by the beginning of October to a lower rate. We're now, I mean, the numbers keep going up. I mean, the numbers have kept going up since we've started to have these conversations, and I just think that we have to understand that is the trend and that is the direction that this is going, and that is part of the reason that the governor has stepped in with some more restrictions. I just have another question, Pete. When it comes down to vaccines, what is a sort of a goal vaccinated rate that we're looking for?
I mean, what did they say? The goal, I mean, the goal to get at would be to try and get as many people as possible. You know, we talk about, you talk about the idea of herd immunity. And so you need to get to a certain threshold within a community, right? To be able to have everybody be protected, and vaccine is the safest and way to get to that point.
So again, what you're saying there is that, you know, part of the goals of what we're doing with when we roll out vaccines, when it comes out to getting people vaccinated, is to emulate herd immunity.
Correct.
And herd immunity is a super majority of the population.
Right, or that there's just not enough, there's not enough people who are susceptible to significantly spread the virus around anymore, because enough people are no longer susceptible to the virus.
And currently, where we are population-wise, we are well away from herd immunity. Is that correct?
Correct.
So
Yes,
I mean, so again, part of the reason that the mandates are there and part of the reason we have restrictions is because a lot of the population is susceptible to COVID. We need to be concerned about that. But eventually, when we get to vaccines, there will be the department's job and our work to encourage as many people to look at being vaccinated. Again, because that's going to let us get grandparents together with their grandkids safely.
Absolutely.
This is Tamara. Comment on what Kyle said? I'm sorry.
Go ahead, Tammy. You wanted to say something, Tammy?
Yeah, a couple things. The majority of our tests in our community are all done in the lab at the hospital, not in Bozeman. The other thing about the number of tests that have been done, they are not going up substantially. In fact, the last couple of weeks, the numbers have gone down, the number of tests that we've done. Dr. Birx from the CDC, her recommendation is, like Kyle, you had alluded to, that we need to do more testing, broader testing to identify the asymptomatic people who are spreading COVID without knowing that they're positive and they're still in the community. So almost to kind of test your way out of, to identify the asymptomatic people so you can quarantine them and quarantine their contacts as well. So I just wanted to answer a couple of those questions.
Thank you, Tammy.
Yeah, very good, Tammy. Thank you for that. Yeah, and then also at the hospital, there for that reason, there's a drive-through COVID testing available that is now up and running, and that's, you know, that's really kind of the point of that, is to try and get those tests for people who are minimally or asymptomatic, and to ramp up that capacity.
Thank you.
Dr. Pate, I'll just add that I went through the testing procedure, I think it was on Tuesday. I had been exposed. I don't have any symptoms, but it was a painless procedure. By the time I got up to the tent, it had taken maybe 2 minutes or so, and maybe a couple minutes waiting there. And I was in the tent maybe 2 or 3 minutes. The whole thing was less than 15 minutes. So drive in, drive out. They have plenty capacity. And I certainly recommend anybody that's concerned, if you've been exposed or just want to have some assurity that you're okay, go get tested.
Yep, and let me speak to one brief point about that. So certainly increased testing, that's what we want to do. We want to keep passing to keep testing people to find the minimally asymptomatic or asymptomatic people who could, or pre-symptomatic people who could still spread. If you remember that if you are planning to do like a get together with somebody, and you decide, well, I'm going to go do a test before I meet with a loved one to make sure that I'm not infected, that's, you know, that does give you some level of reassurance, but remember that that's also only one snapshot in time. If you are exposed, you could have been exposed and then not be shedding virus sufficiently yet, and you still could become a higher viral titers and be able to be infectious later. So remember, don't misunderstand me. Getting frequent testing and more testing is crucial. But to people who do get a negative test, please just remember that that's only a snapshot. That's a snapshot at that point in time.
Could I interject here for a moment? I think this going back to the numbers and whatnot, this question of testing, I mean, in our best case scenario, ideal would be we could test 100% of the population today, and if I understand it, test them again 3 days from now. And when we got the net of those two results, we would be able to tell what is the positivity rate in the entire community and deal with that accordingly. We can't do that, but it's clear from the results that the bottom line is that the more people we test, the more positives we're getting, so that they're more than just a couple of folks out of every 100 that have it. We're probably looking at somewhere between the 25 and 50% and maybe more. We don't know. So it's like part of that is it's part of the message that needs to get out there. It's not a question of how many, it's that positivity rate, which is probably, underestimating what's out there, regardless of whether you lose a percent here, percent there, because you get false positives and whatnot. That's just obfuscation. That's just clouding the issue with irrelevant details. Got to look at the big picture. And I think, frankly, just one last minor comment, I think it's premature to discuss vaccines and how to deal, for you guys to be talking about how to deal with vaccines. We're still looking several months away, and I think we got bigger fish to fry before that. I think what Dr. Fauci said is it's kind of act like we don't have vaccines out there because we have other methods, mechanisms to deal with the problem. Because I think vaccines it opens up a whole nother range of issues, which is just gonna, again, cloud the issue we have at hand here. Thank you.
I agree. I agree with much of what you say. I think just my point is when we talk about pandemic fatigue, which we're all feeling, and this is for me personally, I find it a little bit easier to deal with pandemic fatigue, knowing that something is perhaps on the horizon, and to work to be ready for that. And certainly the vaccine will have. We need to be smart and be prepared to roll it out when it is available. But that doesn't mean that we just kind of put our heads in the sand until that time. And I very much agree with that point.
I just think we got a lot of whining going.
I believe Dr. Bukacek is trying to speak.
All right.
Just because we're tired.
Yep. Dr. Pete, is that about the end of the committee?
That's about what I have to say at this point.
Okay, let's take it back.
May I comment?
Do you have anything to add? That you haven't added already, Annie?
Well, I wanted to comment with what Kyle said, because I think I gave a lot of information, and I think possibly the most important part of the information I gave didn't sink in, maybe because I gave so much information. But the PCR skeptics, it's based on the PCR cycle threshold. And I don't know what the PCR cycle threshold is here at our hospital here, but it's the MSU lab admits to a cycle threshold of 40, which even by Dr. Fauci's standards is considered, what Fauci says, not replication competent. I mean, more or less, you can't even tell what has been amplified. And then there are others internationally that are looking at this that say a threshold over 20 or over 25 creates meaningless positives. So the skeptics of PCR testing, it is based on science, it is based on data. So I just wanted to reiterate that. I might not have been clear.
Okay. So I will, I mean, we've been back and forth with this like I said before, PCR is used in many different infectious disease settings, HIV, hepatitis C, infectious diarrheas, influenza. And so I think I'm going to, we use PCR as a gold standard that we use for many different tests in infectious disease. And I'm going to leave it there and the conversation on COVID at this point.
Okay. Sorry, folks. My wife will answer that. I hope upstairs and the spring will go away. It did. Carrie, can I take the, or Pete, can I take the gavel back?
Please.
And Carrie, how much more time do we have on the rest of the agenda?
Well, oh my gosh.
Are we talking about 10, 15 minutes or?
Yeah, I would say about 15 minutes.
Okay, does anybody need a hydraulic pressure check? Okay, we'll continue for 10 minutes or so. Thank you, Dr. Pete, and everybody else that participated. The next issue is the coordinating committee. I understand that has been withdrawn from the agenda.
So there is no conversation about the lease. I don't know if anybody from that committee wanted to give any updates.
Could I just enter into this?
Yeah, please, Pam, go ahead.
Yeah. So I just wanted to say, in the interest of time, I'll keep it short. But I just wanted the board to know that the committee has been working with the clinic on the separation and all of the details that we're trying to figure out and include up and into, including the lease. And so I've asked for a standing spot on our agenda so that we can report to the board every time we have a meeting and keep the board up to speed, because there will be other stuff that will come probably before the board. And I want to make sure they have the information they need on that. So I guess I just asked for a standing spot on the agenda when we have meetings. And that's about all I have right now.
Thank you, Pam. I'm the only other member on that board, and I fully agree. So Carrie, would you make sure that we have an update on the agenda? It is a committee report. Number 10, I don't know anything about that.
So I can talk a little bit about that. So
please.
The board has been hearing a lot about COVID, and in part because that has been so pressing, we haven't talked as much about what other programs in the health department are doing right now. So I know we don't have a lot of time, but Lauren Bolton hopefully is still on the call. She is our new mental health systems specialist. Again, we've been working on mental health for quite some time, and we were finally able to get a dedicated position this past fiscal year. So Lauren started in July, and I can see her on the call there she is. So I'm gonna hand it over to Lauren to talk a little bit more about what she has been doing in mental health.
Awesome, thank you, Carrie. In the interest of time, I will be quick. To give a little preface to the work that I'm doing, for the past 3 community health assessment cycles, mental health and substance use have been identified as the highest priority need in Flathead County. Approximately 1 in 10 adults are dependent on using illicit drugs or alcohol, and an estimated 15,300 Flathead County residents age 18 or up have a mental illness. So as Carrie had mentioned, there has been a lot of work that has been done before this position was created in the world of mental health and substance use or behavioral health. And so largely what I have been doing in my short time is to really start to put all the pieces together of what's going on, not only at the county level, at the health department, but also in other organizations. So I don't know, Carrie, if you can share that PDF really quick. So byproducts of a few of the mental health systems projects that have happened before I was employed in this position are our co-responder project and ESPER projects. So back in June of 2019, there was a sequential intercept mapping project that some of you may be familiar with that mapped our criminal justice system. And the highest identified need was that we needed a co-responder to respond with law enforcement for mental health related calls. So I'm really happy to say that as of August, we have hired one co-responder, and as of November, we now have 2 co-responders responding with Kalispell Police Department and Flathead County Sheriff to any mental health related calls. They also have a care coordinator who is coordinating with those individuals that have been responded to. So you can see those numbers up there. We have responded to 19 calls of people who have a serious disabling mental illness, and then 36 total that have less than a serious disabling illness, but may have been experiencing some form of crisis. So the program was kind of put on hold because of COVID. It was really hard to hire people. Originally, we had started in or been aimed to start in January, but now we're kind of up and running, and the co-responders are responding. And so hopefully after the next couple of months, we will be able to see some data related to how much sheriff's time is being saved and how we're diverting from the emergency department as a result of utilizing this co-responder. Also, as a part of that, we were awarded a SAMHSA COVID-19 Emergency Crisis Mental Health Grant, which is also funding a portion of that co-responder. And then a little portion of that grant is also allocated to provide mental health services for health department employees who have been affected by COVID-19. So we are able to offer group talk therapy sessions to our staff who have been responding to COVID-19, and hopefully we will be able to do that throughout the duration of the grant cycle, which ends in August. So we just started implementing in the end of October, so next month we'll have some more numbers, but as of right now, I think there's been 6 staff members that have utilized this service. So I hope to see that increase in the future as a support for all of our staff that are working really hard. And then as far as ESPER in the school setting, ESPER stands for Screening, Brief Intervention, Referral, and Treatment. So it's a substance use screening tool that we had been trying to pilot a program at Linderman Education Center to teach their staff members the principles of ESPER so that they can implement that with their students in a more casual, non-clinical setting. However, because of COVID, there was a lot of stress put on the school systems, and their capacity to be trained in these extra tools is very, very small. So the grant has been extended, or it has been extended until June 30th, but we are also looking to maybe extend it a little bit further to work in tandem with the Montana Healthcare Foundation grant that was awarded to the Health Center and Intermountain, so we can kind of get that community aspect and clinical aspect. So there'll be more updates to come on that grant. And then as far as systems work goes that we're doing for the behavioral health systems, we are kind of still in a very inventory taking phase. We just underwent a behavioral health systems mapping project that is mapping the behavioral health continuum across youth, adult, and senior sectors, and it's mapping from prevention services all the way to inpatient services. So what we're really trying to do is get an understanding of not only what services are provided in Flathead County, but also what the capacity is. And so we're hoping to utilize some data to give us an idea of how individuals flow through that system. And that should be available by the end of February. That's kind of the biggest work in progress right now. But I'm so excited to see the results of that, because I think that the product of this project will be the foundation for a lot of this systems work that will take place leading into the future. And then lastly, we do have a public health systems improvement grant that is being used to supplement mental health services for Flathead County Sheriff's deputies so that they can have fit for duty evaluations, or any sheriffs that are involved in officer involved shootings, any of those maybe extra expenses for mental health support for those sheriff's deputies are being funded out of the public health systems improvement grant. So this is a very general overview. There is an attachment to the agenda that has a outline of all of these grants and the FTEs and job descriptions and populations that all of them are serving. So it's a little busy, and I don't think we need to look at it right now. However, if you did want to get a better understanding of all of the grants that are kind of funneling through the health department to the community and what they are all doing, you can take a look at that document. But that's an overview, and if anybody has any questions, I'd be glad to answer.
So on the obviously the co-responder project is getting a lot of press nationwide. How with police reform and things like that right now. How long is the grant on the current co-responder project?
So the grant is our county tribal matching grant, which is up in the end of June of 2021, but we do have through the SAMHSA funding an additional 2 months of funding. So right now that is through August of 2021. The plan is to hopefully have enough data over the next couple of months to really have information backing about the amount of money that it saves, sheriff's deputies to look at sustainability for this project. However, we will be able to apply for a county tribal matching grant again in the same capacity to fund a co-responder if that's something we choose to do.
And are you using do law enforcement like surveys or anything like that be used as a metric for the efficacy of the program?
So law enforcement surveys, like from officers, or
yeah, like as to is there anything that measures their overall feedback of the program as far as appreciating having a mental health professional involved in these situations?
Yeah, that's a really good question. We don't have anything formal yet, but we have, anecdotally from Sheriff Haino and from Chief Doug Overman, but that's a really good point, and hopefully we can put something together because I think that would be really beneficial in our final report of the effectiveness of the program. Thank you.
Gary, you're in charge.
Okay, if nothing else, if no one has other questions for Lauren, let's move on to questions about other departmental reports. You can also submit any questions you have later. We want to continue to provide more information about all of the other programming that happens at the health department, but I also recognize that these meetings are quite lengthy as they are, and we can't quite fit in departmental reports all the time. So any requests from any board members about specific reports, specific items they would like information on in the future?
Gary, we usually have a report, and I'm just not seeing it in my packet, that does track sort of where influenza is and stuff like that. Is that underneath population health? Just so.
It should be in Pop Health. However, I will say all of our CD folks were extremely busy this week. It's possible it didn't make it in there. And I also didn't check it this week. So
yeah, I don't see that it's there. I do think that it's great
That's
something
probably
to
my
have.
fault.
I do think that Dr. Bukacek is raising that. I know as a newer board member, it is helpful just to see that we do track that information and have that information available historically. So that would be
yeah.
great.
I will go back and add that in. It is something that we do normally we post every month. I would just add that this week, last year was when we first started seeing influenza cases or influenza hospitalizations. So that's something we are tracking. It is tracked as a separate process from COVID. And we are hoping to have another very good year for influenza. There were 0 influenza fatalities last year. So we would love if the same happened for this upcoming influenza season. But again, that's something we'll track and report on monthly.
Great, thank you.
Do we have a committee report for home health? And that'd be Dr. Bukacek?
Yes, I'll be very brief. We had a great meeting on Monday, and the most important, well, I'm going to say the most important, but one of the things that we discussed was a perpetual problem that home health has had since 2018, the cash balance slowly decreasing. And Courtney has explained it very, very well. It has a lot to do with CMS issued a rule I believe last November for implementing the patient-driven groups model at PDGM, and it's the decrease in income in her estimation is due to being paid based on a functional score combined with the referral source and diagnosis. So we're going to meet again as a committee January 2021, and we've discussed some possible strategies. We're going to talk about it more for addressing this problem. That's it.
Okay, thank you.
You're welcome.
And then it's to Cliff for the animal shelter.
Okay, Cliff?
Well, can you hear me okay?
We see you too.
Okay. Things are kind of quieting down here. We worked all the way through our waiting list that we had on cats, so we're kind of back into a regular rotation through, and we had a recent visitation from a noted shelter veterinarian from the University of California at Davis, and that was very enlightening. And so we continue to try to be transparent with our reporting and try to keep up on the latest and greatest of shelter studies. And today is actually vet day here, so I apologize for having to get up a few times, but 2 days a week we have our veterinarian, Dr. Gordon, in here to tend to various health issues, and so today's that day.
And Cliff, I think you're too modest, so I'm going to add my 2 cents. That I think it's incredibly important to note that this is a small county animal shelter. They run a lean operation, and to receive recognition from a national vet at how well they are operating and what an incredible job they're doing of taking care of their animals and getting them adopted is quite a big deal. So thank you, Cliff.
Well, thank you. It was humbling and an honor. And this is our 3rd visit from this particular Dr. Cynthia Karsten. She's nationally board certified, and we have a supporter of the shelter who gives her use of a vacation home if she spends a day at the shelter, and we always benefit from that. And the staff's very enthusiastic about and very proud of the fact that we are in the middle of all the latest and greatest shelter guidelines. We follow them proudly, and so I'm very proud as well. So thank you.
Carrie, did we share that with the entire board?
Yes.
Members of the department, and particularly the commissioners?
It just went to the Board of Health.
Can we share that with the commissioners? Mm-hmm. It's a very, very special accomplishment that needs special recognition. Great job, Cliff.
Thank you.
And your staff too.
Thank you. Couldn't do it without them.
Carrie, is there any one of the departmental reports that you want to bring to our attention other than the reports are there?
Nope, they're there. Look them over.
And the health officer was here a moment ago and she's disappeared.
Tamile's on.
I can't see her.
I'm here.
Tamile, anything from you that you'd like to say?
That, our staff, we continue to get lots and lots of cases. We've had 100. I think we'll have over 200 today. We had 162 yesterday, 108, 162 on Monday. We're some of our staff are being quarantined by either being in contact or a positive. So that's cutting us short a little bit. We're having our contact tracers kind of continue to filter through. It's a hard job. So, you know, we have some that come back and then, that come and start working and then don't come back. So it's that hiring phase. We're continually doing that. And that takes us, you know, up to 2 weeks to train somebody, because we have to get them on our onboarding system of the county. And then we have to train and get information for them to be able to access the statewide database, which, you know, takes some time as well. So we continue to move through them as quickly as we can. We had 36 school cases today alone. So I did train the schools to help us start doing the contact tracing. Luckily, I did that on a couple nights ago. So that's helping us get through some of those. When we talk about media, the one gentleman was talking about media, the Whitefish, they have done a fantastic job coming out with a big media campaign for their community. I can't say enough how great that project has been. And we have another meeting tonight at 5:30. We did have the hearings were for the businesses who the state filed against this last week, and we did not win that hearing. It did not go in the favor of the state. So I don't know where that's going to go moving forward.
You provided testimony, did you not?
Yes, I was subpoenaed, yes.
Yeah, and you did provide, you appeared and provided testimony.
Yes, I'm not going to jail anytime soon, yes.
And if I read the account correctly, that the judge basically rejected it. Is that correct?
Yes.
So we're not getting support from the commissioners, the sheriff, the county attorney, and one of the judges. Well, that's a legal issue. I'll not say anymore.
Yeah.
Does anybody have any other comment for the good of the order? Or the bad of the order? Any comment at all?
Bill, I'd like to second your comment from the very beginning of the meeting about Roger's role on the board and his expertise, and that is yes, COVID pandemic is obviously at the forefront of everybody's thoughts right now, but I just wanted to voice my agreement with your comment at the beginning about Roger's expertise and level of involvement with important board decisions.
Thank you. I don't think Pam was on the call there, but I think Pete said exactly what I said. He's a valuable member and he deserves to be reappointed. Anybody else like to speak? I don't have my calendar open.
And
I'm
Bill,
sorry.
I'll just jump in real quick. Again, the personnel committee, we're going to be working forward on things. I know we're going into the holiday time, but I will keep the board and the public informed of what our decision-making process is. I do want to again reassure the public that, you know, we looked at some pretty top-notch candidates. I mean, the candidates who made it into our finalists, I would confidently say believed in science, public safety, and current health recommendations. Don't take the negotiating process as being any pause of what we're doing. We're working on trying to do the best to do the for the community to hire a health officer, which is one of our critical missions and responsibilities as a health board, is to actually fill this position. So I think it's also important to remember that for the health board, it's our job to make sure that we support the staff and Tamalee until we get a health officer here. And then once we have a health officer here, it is our important duty to support a health officer that we hire. So again, I will keep everybody informed as the process goes through, with that understanding that we're about to go into a holiday week.
I just wanted to thank Kyle for his leadership on the personnel committee, and I can only imagine the untold hours that he's put in. And I think that he did a great job. And I think the recruiting agency that we hired did a great job as well. So I just wanted to thank you. And I also wanted to say that I have no reason to doubt that everybody on this board has the best interests of the community in mind. I have no reason to doubt that. We have, different opinions maybe about what's best for the community, but I think we all care. So I wanted to thank you for that.
Very appropriate comments. Thank you.
Thank you, Dr. Bukichek. And again, I would like to point out that, a lot of the heavy lifting is being done by, that we recruited an agent to come in and help us with this search. And then we also have HR department of the county who's doing a lot of work with this. And yes, I have been in communication also with our legal and HR often. So thank you for that.
Artis, any comments?
You know what? At this point, I don't have any comments.
Okay. Did I leave anybody out? I'm just checking my calendar. Carrie, can you confirm our next scheduled monthly meeting? I'm going to guess it's the 17th of December. Is that about right?
Oh, yes, it is the 17th of December, unless the board chooses to change the time.
Okay. And we can consider that. Any other business? May I have a motion for adjournment? Come on, somebody. I heard it. We don't have a discussion. Everybody say goodbye.
I second Artis's and motion to adjourn.
Thank you, everybody.
Have a good Turkey Day, folks. As good as you can have.
All right. Bye-bye.
Bye-bye, everybody.